everybody, and welcome to today's webinar on what you should consider when working with scar tissue. Thank you so much for joining. Really looking forward to this session. The webinar today is split into two sections. We will have two presentations from Emma Holly and Hannah Poulton, about 15 minutes each, and then that will be followed by question and answer and discussion where you get to pose your questions to Emma and Hannah and get them answered. A little bit of housekeeping just first and foremost. So the session is being recorded. So if you're watching the live session, you can catch up on it at a later date and you can watch back in your own time. If you do have any questions throughout, there's a Q&A function which you can find at the bottom of your screen. Add your question into there and we'll try and get them answered. For anybody who is watching the recording and you have any questions, our email will pop up at the end. You can send in the email and we will try to get that question answered for you as well. Quick introduction. So for those of you who don't know me, my name is Dominic Smith. I'm the Clinical Application Specialist at PhysiQuip. And for those of you who don't know who PhysiQuip are, we are a medical-based technology distribution company in the UK. Our job here is to search the world and bring some of the latest technologies in the rehabilitation sector to the UK market. Alongside that, we have our education and training, where we want to bring some of the leaders in the medical sector to our platform to provide the education for you, hence why we have Emma and Hannah today. So with that being said, I'm going to hand over to Emma, who's going to introduce herself and then start us off with the presentation. So Emma.
Hello, thanks so much, Dom. It's been lovely to do this first webinar that we're doing together for PhysiQuip with the amazing Hannah Poulton, who's going to give us a case study in a minute. So the purpose of today's webinar, the reason that we wanted to kind of come together with PhysiQuip and with Hannah Poulton and myself is really just to do a kind of brief overview of what should be the considerations when you're working with somebody who has scar tissue. Scar tissue is something that I myself have become very passionate about. It is now what I do. So my company Restore Therapy both specialises and exclusively trains physical therapists and people who are working in exercise and movement about what you can do to help people in recovery. I've had some great experiences working with some really big cancer charities, the UK's leading cancer hospitals such as the Christie. I've done training with them. I've done training with within the sporting fields with British Athletics, with Elite Rugby, Saracens. I've also done work for 3 years with the Invictus athletes, which has just been a really amazing experience, collating together a team of volunteers, and collectively we've delivered over 550 treatments to people who are taking part in the Invictus Games on behalf of Team GB. Unfortunately, our current team is now waiting for a second year to be able to get the games going, but it is on target for next year. And just lots of people who've got, you know, small clinics as well who see people, because if you're working with people, you are pretty much going to be working with people with scars. I have a clinical practice in London's Harley Street, and I'm here to talk to you about why you might need to think about scar tissue. And of course, if you think about the phases of wound healing, initially it's a wound, and then as the tissue matures, it becomes defined as scar tissue. From the very moment that you incur an injury, your body is fighting to try and stop any debris, any pathogens entering the body and creating an infection. And then it's also trying to rebuild that tissue and trying to repair. So we start off with hemostasis very early on, and then quite quickly that moves into the inflammatory phase, which is a really key phase to start initiating wound healing. Lots of people kind of have a thing about, you know, trying to reduce inflammation all the time, but certainly within early wound healing, it's really important that you do have that inflammatory phase. It kickstarts a whole process of cellular activities, and wound healing itself is incredibly complex. There's lots of different interactions carrying on as part of, you know, each stage of development, and it's to do with the kind of cellular activity lines being in one stage and another. And we quite often learn about wound healing in these kind of 4 very classical phases. So you go into inflammation, you change to proliferative, and then your collagen will start to change as you move between proliferative and into remodeling, which normally starts around about 21 days and continues, all importantly, for really quite a long time, up to 18 to 24 months. Your tissue can still be remodeling that early immature type 3 collagen into a more mature and stable, but also slightly more fibrous type 1 collagen. And it's a connective tissue repair. So it's important to remember that the tissue that got damaged in a trauma or a surgery is not the same as the tissue that gets replaced when somebody has a scar. You'll hear me talking about scars a lot, whether it's in this webinar or over on my Facebook and in my courses and things. And lots of people have scar tissue which isn't causing them any obvious problems. But there's still things that we can do to support optimal healing. So here we have some ideas in which we could suggest to the patient ways in which they can care for their scars, which are evidence to help scar tissue formation, to provide optimal scar healing. That could be creams, oils and gels, silicone products. Sun protection is one people don't often think about, but certainly when the tissue is damaged, the melanin production within the tissue isn't working properly. So making sure that you're protecting that more fragile tissue from the sun all through that remodeling phase is really, really important and ongoing, particularly depending on where it is in the body, if it's going to be exposed to sunlight. Use of compression garments, very frequently done, particularly after plastic surgery, where they're looking for those optimal cosmetic results of a good healed scar. But why wouldn't everybody want a good healed scar? So if there's things we can do to support scar healing to really be visually as good as possible, why wouldn't we want to give that advice? And people aren't getting that advice. And then, of course, self-scar massage. It's something that is certainly increasing in awareness. I'm happy to say in the time that I've been teaching about scar tissue, there's more and more hospitals now that are producing better leaflets to inform their patients on how to look after their scars. And that manual intervention, even by self-care, is so key. And I think more and more that will become a part of everybody who has a scar tissue, understanding that what they need to do is keep that tissue moving. The reason that hydration is so important is because of transepidermal water loss. So where you've had your normal healthy skin, it's providing a barrier function to keep the hydration within the tissues and obviously stopping pathogens entering from externally. And during scar healing, that gets obviously damaged where the skin hasn't got the same quality and thickness, and particularly in early healing. And if you use the right products, what you're doing is you're giving a message to the body that doesn't need to keep laying down more tissue in order to thicken up that barrier. So it can help prevent excessive scar tissue formation, and the tissue that's forming that is lacking in that normal hydration of the tissues can be looked after using these kind of products. So ideally you want a product that's going to be humectant. So that means it's going to sort of suck in moisture from around the area into the area that's been damaged. It's occlusive, so it's providing a barrier function, and emollient, so it will help with the suppleness of the tissue. And this could be a choices of using a cream, an oil or a gel, but look at what functions that product is providing, and also think about whether or not it's actually got any evidence behind it to show that the ingredients of the products are actually going to be able to help support the patient that you're working with. And that's really important. Like I say, even further down the line, scar tissue itself is going to be a bit more fibrous, a bit more dry. So whatever we can do to keep looking after it will improve the quality of the tissue, which then obviously sinks into the skin underneath. And then when you're in a physical clinical setting, there are services that you can provide. And here's where, you know, the kind of main body focus of our talk is really, where Hannah and I are going to talk through the options that you can have and how we work with people who've got scarring. And there's obviously that physical interaction. So something that you're physically doing with the tissue, either manually or with tools or with a device. We could also be influencing the stretch that's on the tissue. and the fascial dynamics using things like kinesiology taping, and all importantly, that's all wrapped up with the right kind of emotional support, so that you're providing that holistic patient care, not just looking at the scar, thinking about how that trauma has affected them on a physical level locally to the scar, and also you know, how it's affected the rest of their global body dynamics. Is something else got stiff or sore or tight or weak as a result of the injury that they've incurred? And thinking about how we might interact with that client, with the time that we've got with them, in order to ensure that we bring the kind of changes that they need to get to a better pace with their health. And that should also all be kind of wrapped up in a load of questions about that individual patient that's in front of you. So the thoughts would be, first of all, what stage in that diagram that I showed you at the beginning, very unlikely that they're going to be in hemostasis, but they might still be overlapping with some inflammation that does carry on and overlap with some of the other phases. They might hopefully have passed through the proliferative phase, unless you're working incredibly early on, which would then start moving into the remodeling round about 21 days. So these overlapping phases. So what stage, what actions are going to be beneficial depending on where they are? So if it's very early on, you may choose that actually what's really needed is lots of decongestion to help reduce the swelling, to help take away some of the pressure on the tissue. If it's a slightly more mature scar, you might want to be then thinking about, my action at this stage is to actually come onto the scar itself and think about whether or not I need to mobilize these tissues, whether or not I need to work on stretching these fibers as they turn over from a type 3 to a type 1 collagen. They might be inclined to get more fibrotic, more shortened, more contracting, some scar adhesion, so some sticking might have started. So I want to keep that stretchy and loose with my actions, with my physical therapy actions. And then if you're working with somebody with a much more mature scar that's healed in a way that is dissatisfactory, you may wish to initiate a bit more of a trauma to start a healing process. So you may wish to agitate or irritate the tissue, break down some fibers in order to kickstart some more inflammation, and so on. And then you have to think about the frequency. So how often should you be seeing this client? And thoughts around that would be obviously to do with, you know, the duration of the appointment, which is the next point. How long should the action be applied to generate sufficient changes whilst not overloading the system? And those two should really be kind of considered side by side, because the frequency and the duration may depend on how healthy that client is, any comorbidities, what else they presented when they walked through the door. So is your time limited to a certain duration, let's say a 30-minute or a 60-minute slot, and what are you trying to address to keep them moving forward? Is it only about the scar, or is it also about some other muscles or structural issues that they've got going on? Do you need time to build in exercises? And therefore, how often do you want to see them to check that those things are progressing in the way that you want? How often do you need to keep checking in with the scar? Maybe more frequently in early healing, and may become more spaced out if you're working with somebody who's presenting with mature scar tissue, for example. And that thought of not overloading the system, if you're seeing somebody really early on, they may be really quite swollen and have a lot of inflammation. We know that any physical therapy treatment does create waste products, which you then ask the body to process. And if somebody's already got a lot of swelling and inflammation, and the actions that you're applying are not decongestion, then you could be overloading them, and just, you know, they could feel, you know, much worse the next day. Their swelling could increase, their pain could increase. So thinking about that caution. And if you apply too aggressive an action into early in scar healing, you could of course break down some cohesion that's supposed to be happening. You've got to remember that the skin tends to heal first, and those underlying tissues, particularly things like muscle sutures, may take longer. More fibrous tissue may take longer, tendons take longer to go even into the inflammatory phase, they take longer to go into that remodeling. So thinking about what kind of tissue has been damaged, what levels of tissue, how deep is that trauma, what's going on underneath, and what would be the consequence of over-treating or inappropriate treatment. If you selected the wrong thing with this person, if you got them to do an exercise that was inappropriate, is it going to burst the sutures? Are they going to you know, feel really uncomfortable. So those are the kind of thoughts that you're considering. And that becomes more thoughts for you to think around when you're working with somebody who's got more of a pathological scar, so a scar which you know, is presenting with dysfunction and problems. And we can classify our pathological scar tissue in different ways. So common classifications of pathological scars, the most common that you will have likely heard of is your keloid scar. So this is a large overgrowth of scar tissue. It's red and it's raised, and it goes beyond the boundaries of the original trauma. Keloid scars will be very itchy. They can often be painful. Visually, it's not the kind of result that most people will be looking for in their aesthetic scarring. And similarly, hypertrophic scars, which often get confused with keloid scars, are again, they're red scars, they're raised scars. Not only do these scars have more overgrowth of scar tissue topically, so on top of the skin, but there's also more scar tissue being produced in the underlying layers. You've also got common classifications of scars that are pathological. Widespread scars and contracture scars often form after severe burns and things, and very worrying if they're around joints. But it's important to remember, and this is something I promote a lot with the sort of training and the work that we do to try and increase awareness around scar tissue, is you could have a beautiful normal atrophic, fine line, flat pale scar on the surface of the skin, but that doesn't mean it's not pathological in the way that it's functioning in the underlying layers, in the way that the scar tissue has healed deeper in the area that's been traumatized. So that could be scar adhesions, scar tissue fibrosis, scar tissue contracture, such as capsular contracture, very commonly seen after breast augmentation, or also people who've had breast cancer and have had radiotherapy following the implants of silicone or expanders. And with these individuals, superficially, the scar may look fantastic, but they will be experiencing problems around how their scar tissue feels, or around how it affects their functionality of their fascial dynamics. So for example, if you've got a scar adhesion, if you don't assess that patient properly and they're lying on your therapy table flat, you may not notice very much, particularly if it's healed very beautifully on the surface. You're going to need to look at that patient in different positions and move the tissue when they're lying on your therapy table in order to effectively assess whether or not there is any scar tissue adhesions. And normally then, if a person then stands up and the tissue hangs differently or moves, it's with that movement, with that standing position, that you may then assess whether or not they've got some scar tissue adhesions. But there's lots that we can done to help, and that's what inspired me to develop the scar tissue training that I offer, both from starting off, if anybody's interested, just to come along and do some work, really basic sort of hands-on course, a one-day introduction. I do a full 4-day course where you learn tons of different techniques at working with different levels of scar tissue and understand about treatment planning and how to progress deeper into the tissue. And then also Hannah and I have worked together to bring this really comprehensive course, which is what started off our relationship with Physiquip, actually, to investigate different ways in which people could introduce different tools, different ways of working in a physical therapy setting. And that Understanding Scar course is something that's on sale at the minute. So we bring you lots of information. So from introductory skills, comprehensive classroom training, to detailed theory. And at the moment, for the rest of this week, you can save £100 on that online course. And why we think this is so important is to really understand how you can take a patient and think about what you should apply and your reasons behind applying it. And that allows me to pass on really nicely over to the amazing Hannah Poulton, who's going to now put these thoughts into a real case study that she's worked with, had some phenomenal improvements with this lucky woman to have found her. So Hannah, I will pass over to you. We will get the
Thank you so much, Emma. That was brilliant. Thank you. I think, am I in control now, Dom? Yes. I can't seem to find the cursor to move the screen across. There we go. The system works. Hello, everyone, and welcome. Thank you for joining us. My name is Hannah Poulton, and I'm the Clinical Director of HLP Therapy Clinics based in Leicestershire. I'm a senior physiotherapist with over 20 years experience. I've been the senior in medicine and neurology, and also the clinical lead for physio in our local hospice in Leicester. And obviously, more recently, working within SCARS and using my combined knowledge over the last 20 years to be able to effectively treat SCARS. I'm very honoured to work alongside Emma Holly in the Understanding SCARS course, which is an amazing in-depth online SCARS course, which I know people in the chat box have already started commenting about, who've already done that, and well done for you for completing it or getting through it. Well done. It really is one of a kind. So I am presenting today to talk to you about a case study of a client that came to me. I should just like to point out that I'm also an acupuncturist and a mummy MOT practitioner. So I deal a lot in women's health in general, and I pull these treatment modalities and techniques all in together to create that holistic treatment for every client, which I'm sure as clinical practitioners, you do the same, and you pull out those tools in your toolbox. So the case study that I'm presenting today is an amazing 39-year-old lady. She already had a child who was 7 years old. She was pregnant with her second child, and unfortunately she had to have an emergency C-section. Now, just stopping right there, this is why it is imperative that you collect a really detailed history from your client straight away. So an emergency C-section, how do they feel about having that C-section? And in your head, when you're asking these questions, let them tell their story about their labour, about, you know, how long they were in labour, because of course that will impact your treatment and how the scar is. If they've been in labour like this lady for 2 days before then having an emergency C-section, think about the emotional impact of the body. They're going to be dehydrated. They're going to be sleep deprived. Their hormones are going to be completely shot. They might have had to labour on their own without a partner. So they might have been scared. They might have been lonely, frightened, and not knowing what's going on. And then, of course, that emotional impact of then having a C-section, which might not have been part of their birth preference. And of course, I call it a birth preference rather than a birth plan for very good reasons. This is an individualised case study. I'm not saying that all C-sections are traumatic. Some C-sections are excellent, and you can have the C-section birth that you dreamed of. However, in this instance, this emergency C-section was highly traumatic. So as a clinician, I'm thinking all the time how that will impact the tissues. You know yourself if you are anxious, scared, if you hold in your tummy, you know when you get worked up over something, how that feels. Do you flex forward, pull your shoulders up when you when you're going through a trauma yourself, or you know, might not have had enough sleep or are anxious? You think of that physical response just in that moment that you're going through on your tissues. So now collate that to an emergency C-section after 2 days of being in labour, and now it's highly traumatic with the recovery. And on top of that, this lovely lady had multiple infections, and we will talk about that as we look at the photo in just a minute of the scar and work through what the scar is telling you as soon as you look at it. I'm not sure about you, but if you work with a lot of postnatal mums in your clinic, you might find that they have been given the diagnosis of postnatal depression, which of course is probably more prevalent than we would care to admit. However, I don't know about you, but I'm seeing actually a lot of women that have post-traumatic stress disorder from their C-section birth. coupled with obviously going through lockdown and COVID and not having partners with them. And actually, I'm wondering that crossover between postnatal depression and post-traumatic stress might be going undiagnosed, but that is also something that can be highlighted in your initial assessment, and you can make recommendations onto other health professionals if this is outside your scope of practice, but you're highlighting that they might need that extra support. So this client arrived 5 months after her C-section, and this is her scar. So follow my cursor if you can see it, and on the right hand side you'll notice that the scar is pinned in. Now every scar tells a good story, and what you'll find with your scar is that there's no singular, very few singular perfect linear scars. You might get 3 scars in one, which is exactly what this client is presenting with. Excuse me. So on this side, you can see that the scar is pinned in almost right through to those tissues. And if we think about a C-section being cut through those 7 layers, you have your fascia, you have your linea alba, you have obviously all the multi-layers of your skin, you have linings over your organs through the uterus. You think of that being pulled down as the surgeon is pulling the top fibers and bottom fibers together to form that scar. You're going to get that real deep pinning in certain places along the scar, because your body's trying to obviously heal and keep you together. So we have that deep lining here where it's pinned in. And then, as Emma has spoken about so clearly about wound healing and how important it is to know this in relation to your scar and what stage your client is at in their wound healing, you can see that it's a hypertrophic scar, almost verging on keloid scarring, but that hypertrophic where the collagen changes from type 3 to type 1, and the body is producing collagen at a rate where it gives this rope-like appearance over the scar. And you can see the indentation, and you can see that this scar is hypertrophic nearly all the way along. Interestingly enough, in clinic, when you see a lady with a C-section scar, pay attention right underneath the belly button in that middle of the scar. As showing here, you can see that depression and of the scar. And what I'm putting it down to is that fascial connections that run, especially from your joint to your jaw, to your pubic bone, that deep fascial line that actually has then tethered the scar in. So next time you have a C-section client in, have a look and see if you can see that depression right underneath the belly button in the middle of the scar. And then of course you get more hypertrophic scar, and then it goes deep. Now, interestingly enough, as an observation, always ask your client if they're right or left-handed. Their most dominant side, in this case, this lady was left-handed, you might see an increase of the C-section being pulled up within those fascial lines, because of course you have slightly more muscle bulk on the side that you are the most dominant in. So have a look and see if this correlates to some of your clients. So of course, multiple things that we can do with the scars, but have a look at those tissues around the scars. We know from our extensive history taking at the beginning, it was traumatic, multiple infections. It was an emergency C-section. She'd been in labour for 2 days. And can you see the damage on those tissues? You've got obviously stretch marks, which, as we know, they are the fat cells which have stretched underneath the skin, getting trapped underneath the skin. We can see changes within the skin texture and quality. Dehydration is probably a big factor here, because the skins do not look well hydrated, and of course they look tight. It looks inflamed, it looks uncomfortable, doesn't it, as you're looking at that? And if you think of where a C-section scar is, you cannot rest that scar. Potentially, if it's on an arm, you can rest your arm, but think about those deep layers that the C-section runs through. You're looking at your transverse abdominals that you're always engaging when you're sitting up or breathing. Think about the linea alba fascia and your pelvic floor fascial connections, which will be pulled underneath that surface. It is very difficult to rest and allow your C-section scar to heal. So let's use all those tools. Let's look at the ergonomics, which I did with this lady. She was sitting at a desk. She'd gone back to work super quickly. So let's have a look at doing some stretching. Let's have a look at changing her desk and chair height. Let's have a look at posture correction. Let's look at deep breathing, that connection between your diaphragm and also your pelvic floor. And for those of you in women's health, you know how important that is. With this lady, there was trauma in touching the scar with obvious reason, and also with starting any kind of self-massage because the skin was so inflamed and because of the emotional trauma. So what did we do with this lady? So the treatment, first of all, as you can imagine, emotional support. I listened, we worked through a plan together of getting her extra help, which was beyond my scope of practice. Never think in private practice that you have to have all the answers, and don't ever work outside your scope of practice. So always refer on when you can. We looked at hydration of the tissues, and what Emma was clearly saying is we need those three things, those deep layers of moisturization, the barrier over the top, and also that emollient of the hydration around the tissues, which is absolutely key to this client. We looked at nutrition, getting grains, oats, protein. Your protein is your powerhouse source for your cellular activity and recovery. And of course, water, your 60% water. Of course, your scar loses so much moisture and water in those early stages of healing because it's been split open. You've cut through that epidermis and that transdermal water loss. So get that hydration on board. And of course, I started with this first one, all about gentle self-care, scar care, gentle hands-on scar therapy, not on the scar, but around the scar. So touching her tummy, her belly button, those deep breathing, even working around her hips, because you think of your fascial connections and how the fascia crosses from hip to hip over the front of your frontal plane. The C-section goes right through that. So women might get pain in their hips, in their chest, in their lower back, right into their pelvic floor because of how tight their scarring is. I use, as I've said, a vast array of treatment modalities, and I use the LymphoTouch machine. We started off really super gently around her tummy, getting those tissues, the circulation, breaking down that fascial connection, getting that circulation and hydration back into the tissues. And I used a longer treatment times between treatment times. So I waited about 4 to 6 weeks over a 4-month period, and I did 3 treatment sessions within that 4-month period. And I again used the LymphoTouch machine, but started to increase the pressures. And obviously on the last treatment session, I did for 20 minutes at a really high intensity pressure that the client could handle. And that's the great thing about the LymphoTouch device. You can control the pressures so it's comfortable for the clients, and they get the best experience out of it, and you see results in your scar recovery. I used a combined approach using a really good nourishing scar cream, home care advice, and everything that we've said before: posture, ergonomics, sleeping, breathing. I did physio stretches. I didn't use tape for this client because of the damage around the tissues. It wouldn't have been appropriate, but that's where your clinical reasoning needs to be spot on when you're looking at scars. So what are we waiting for? Let's see the after photo. And here it is. And I've put this next to the first photo here so you can really see the difference. But what are we looking at? We're looking at a massive, dramatic improvement in that scar. We're looking at the tissues being hydrated. We've gone from a hypertrophic scar now to that linear scar, which has started to almost become absorbed into the body. Can you see now it's not so tightly pulled up on that right hand side? It's not as red, it's not as raised, but the big difference, and of course you can't see this on the photo, is how the client interacts and responds with her tissues and with the whole trauma and what she's been through, which makes a massive difference. And this is all part of scar work and scar therapy, and has made a dramatic difference with this client. If you follow me on social media, if you put your phone up to the screen, you'll be able to, not now, but if you 5 seconds ago, if you could see that template, it has all my Instagram details and Facebook details. Follow me at HLP Therapy and on LinkedIn. And I talk a lot about all the different treatment modalities that I use. And I know now myself and Emma are going to be talking about some other treatment modalities we use and the different scars that we treat. So thank you very much for listening.
Oh, it was just such a beautiful change, wasn't it, Hannah? Already somebody's just asked you to just reiterate how many treatments you gave and over what period?
Oh, yes. So it was 3 treatments. So I talked about what I did in the first treatment, and that was really a lot of hands off. More of that some emotional support, more about what she can do for herself with hydration, with posture, with deep breathing, with exercises and stretching. And then that was 3 treatments over 4 months. So you can see that I gave the tissues time to be able to reorganize. So what Emma was saying about those wound healing in the proliferation stage, you get this disorganized arrangement of collagen fibers and laying down quickly of the scar tissue. And then of course the remodeling phase, that maturation period where the body's trying to then reorganize the chaos. So of course it was at that point I'm trying to enhance that body's natural healing response by using the LymphoTouch. They use different types of treatment heads here, and I've got a selection here. I was able to start off with the wider treatment head over the scar and then go down to the narrowest one, and then right at the end use the one that I always use for C-section, which is this one. So I could give a real detailed approach. But 3 treatments over 4 months, that's really good. And of course, you know, folks, this is the best case scenario, and some scars take longer. As Emma said, a scar takes up to 2 years. So in that time, you know, you've got changes. So your clients might take longer, they might take shorter. It's very difficult to tell someone, oh, you'll be better in 3 treatments, you'll be better in 5 treatments. It's every case is individual. That's why you need a holistic approach.
Yeah, and I think, you know, that idea that when I first started off my journey of working with scar tissues, it was through learning Sharon Wheeler's scar work, which is, it's very much that the therapist is delivering the treatment. And with that approach, it's not particularly an emphasis on self-care. And there's, so in terms of getting the patient engagement, I think that was where I kind of ended up going off by myself and doing more research, and started expanding and widening the way in which I work in a clinical setting when I'm down in Harley Street with the different patients that I see, because I guess being in Harley Street, you do tend to get people with really quite complex cases, which has been amazing. But you can't just have that one-dimensional approach of saying, this is what I'm going to do with you. And also in terms of access to you, to being able to actually leave longer between patients can be really, really nice. Other people want that support of seeing you more regularly, particularly if they're, you know, early in healing and on the cusp of when there can be quite big shifts. I think making sure that you keep checking in with that patient, even if things seem, sometimes the scar looks like it's healing well, and then you've got to remember as the tissue remodels, it can, those adhesions and the kind of contracture can start coming a bit later in healing. So keep open-minded is one of the big advices I give when I'm talking about making those clinical decisions, and think about a range of tools, because if you've got a different approaches for working with a patient, you've got more choices of being able to meet more different people's needs. You know, if I go in a supermarket and they've only got one type of product, then that's fine if that's exactly what I need and what I'm looking for. But, you know, as humans, we are so incredibly complex. You've already talked through one example of somebody's complex healing, and different types of scars, different types of skin, different types of patients, some of whom will follow your instructions and some of whom won't take any notice. You know the ones, don't you, Hannah? And so, you know, in my clinical setting, I love using the LymphaTouch. I think it's the device that PhysiQuip sell and promote, and it's a really great device for lifting and really increasing that interstitial space and loosening through the fascia. But I don't use it in isolation, and I think this is one of the things Dom always said to me when I met him. You know, we're not ever promoting the uses of a device totally in isolation. It should be part of a sort of holistic plan. And with myself, I still love my Sharon Wheeler scar work, my original training, that I go back and use those techniques. So that's hands-on treatment, it's given dry. I still use my remedial massage from my historic training from years ago. Sometimes I use my aromatherapy knowledge. I use a deep oscillation tool. I use kinesiotaping. So there's many different techniques that you can pull in, and it's about looking at that patient. What about you, Hannah? What are the different things that you're using on a regular basis? And are there particular client types that you find that respond better to certain types of treatment?
Well, yes, I'll answer that very quickly, and then we'll nip to the question and answers, Emma, because I've got loads of questions that I want to ask you.
Oh,
yes,
sorry, I haven't seen those coming up. I was waiting for Dom to recover. There was quite a lot of swing.
Yes, exactly. Yes.
So I'm thinking I'm smoothing this out, guys. We've got this covered.
Consummate professional there. Apologies for my technical difficulties. I'm back now.
No problem, Dom. We've got 10 minutes, Emma, to answer
okay,
this.
fine.
Yes. So just in answer to your question, Emma, yes, every client is different. One of the questions here is, Hannah, in an ideal world, would you give more treatments? Would you give treatments more frequently? Yes, I would, if it was an early scar. So if you're looking at that 6 to 8 week window, that optimal time healing, if you know they've had no infections, if the scar is closed, you know, stitches have been removed, let's say, yes, I would possibly do one treatment every other week. Maybe start off half an hour and work up 45 minutes, then work up to an hour. With the case study that I presented, it was very clear that we mustn't inflame the tissues any further. It was really important that we did a hands-off approach, gentle, gentle, gentle. So Kirsty Ellis has asked Emma, hi Emma, can gels and creams still have a positive effect on mature scars? I know what you're going to say.
Yes, but it's more limited, would be my answer. So while the tissue's still maturing, that's when you've got that transepidermal water loss, which is when the body's thinking, oh my God, we're losing all this moisture, lay down more scar tissue. And at that phase, the body's making decisions on how much scar tissue is being laid down as a result of the messages it's getting because of the danger of that epidermal tissue being too thin and not providing the protection that it needs. When you look at somebody with mature scar tissue, particularly if it's raised, definitely worth trying some silicone products, not just a gel, but something that provides a bit of compression, but it needs to be worn for a sufficient number of hours and over a sufficient duration. So you're talking months, not weeks. And then creams, yes, can be helpful depending on the quality of the tissue, but again, I think the results are going to be much more limited.
Yeah, definitely. And as part of the Understanding Scars course, we actually cover in depth a whole range of treatment modalities, which includes gels, creams, silicone products, and also medical grade Manuka honey. So we've got an interview there with the people that obviously sell this and use this. And that is really interesting to see of all the different treatment modalities that you can use as part of your treatment. We talk about recommended scar creams like Alhydran that has aloe vera, jojoba oil, and vitamin E. They have the 3 key properties of moisturizing deep into your scar and having that barrier and the emollient round the side. And they are a certified scar cream as well for the treatment of scars. We use a lot of silicone, Juzo silicone products and BAP scar care, especially for C-sections and breast care scars. They do very, very good silicone products for that. And Juzo also do an ACS midline band to add that compression, which I find also can help with the healing of some C-section scars. Now, Emma, I've got a question for you. Fantastic presentation from Mona Carroll. Have you any tips for post-mastectomy scars or seromas, please? And Emma, you have 1 minute to answer it.
No pressure.
No pressure.
Oh goodness. I mean, mastectomy scars, lots of chances of getting adhesions down, and seromas should naturally be able to be dispersed within the body and slowly get reabsorbed. So if they're not getting reabsorbed, think more global, think about what you can do to support that holistic health, because it means that if their body isn't able to reabsorb that seroma, don't just focus on the scar in the area where the seroma is. That's obviously struggling, so take it a bit wider. I think then that might be us.
Yeah,
we might have to do another one, Dom. What can I say?
Well, I know. I'm so glad you filled it out for me.
And also, could I just ask this one last question, Emma, because I know with your Invictus Games you'll be able to answer this spot on. Have you worked with any amputation scars? Any specific advice? Nicola Snowden says.
Yes, I have worked with quite a few amputation scars, and I think I'm never specific of, well, with that type of scar, you know, you have to do a certain type of technique. But I say it goes back to that assessment. It's all about having the skills to do the proper assessment of what that tissue needs. Because I've worked out in Bosnia where with their amputees, they left a lot of loose tissue, whereas in the UK, the more traditional amputations that are done here, the skin's pulled really quite tight, and they both come with different complications for the patients that's living with the stump.
Definitely. And also, yes, in answer, Lisa, to your question, could these sorts of results be achieved in scars more than 1 to 2 years old? Absolutely, 100%. Why not? But it all depends on the person, it depends on the product, it depends on their environment, it depends on their hydration, all those factors that we've talked about. And yes, Emma and I have both worked on sternotomy scars, and think about that line of your fascial connection and how the sternotomy scar will run all the way through it, how tight that will pull on the chest, the rib cage, your breathing. So lots of stretching, lots of deep breathing, lots of gentle work. Yes, Alhydran cream is what we were talking about, and I think that's probably the end of the time for the questions.
Yeah. So we've had a couple of questions, I think, come in. There's other pre-submitted ones. So what we'll do is we'll follow up the webinar with any of the questions, and we'll put them out to people as well. If you've obviously missed anything, you'll be sent a recording as well. So look, to you both, thank you so much, Emma and Hannah, for your expertise, and thank you for filling that little bit of space when we had a little technical there. For everybody who joined us on the live session,
thank you so much for coming, everyone. Really appreciate that, and do tell your friends. Is it too late, Dom, if anybody wants to share with a colleague or share a link?
Not at all. So what we'll do is, following this session, you'll receive an email with the link to the recording, along with a survey. So if you've got any feedback or any suggestions on future things that we could do, we'd really appreciate you just taking a couple of minutes to do, just take your time from that perspective, in feeding back. In terms of things for the future, we've got a few upcoming events. So the Understanding Scars online Scars course that Emma and Hannah have worked very, very hard on. Again, we'll send the link out with that as well. If you type that into Google, it will come up. In terms of some of the in-person courses that both Emma and Hannah are involved in, they're there. There's Hannah's doing one with Mummy MOT on the C-section course. And then we have Emma's Introduction to Scar Work, as well as Scar Work certification, with various dates available. Obviously, we mentioned about the recordings. We'll send out the link, but we have the new PhysiQuip Academy that we've worked very hard on over the past few months, where we're putting all of our webinars on there. We've got over 100 webinars now available, all free to access. So if you find our Academy page, again, we'll send the link out to that, register, and you can get access to this webinar as well as many others that we have done. As we mentioned, we've got a few questions that did come in that we haven't been able to get through and answer. We had some pre-submitted ones as well. If you do have any questions, send them through. We'll try and get them answered for you as best as we can. Otherwise, Emma, Hannah, thank you so much for your time. Thank you, everybody, for joining us. And we shall leave it there.
Thank you, everyone.
Thanks, guys. See ya.
Bye.